party land, independent or nonpartisan. Healing the healthcare blues, the only way we can win.
I'm Mike Huntington. I'm a retired radiation oncologist. I worked in cancer centers for 35 years. I loved my work. I enjoyed helping people through times of crisis. But what distressed me most of all, especially in the last decade of my career, was I began seeing more patients coming in with advanced cancers. It didn't make sense because we were getting better at diagnosing cancer. Well, what was happening was probably no surprise. They were more afraid of cost than they were afraid of some serious illness they were pretty sure they had.
The doctor called him in and said, "Mr. Rader, I'm sorry, but you're going to die. You have liver cancer, and it's inoperable at this point." And then the doctor asked him the question that they probably ask many of their patients: "Why didn't you come to me sooner?" The reason was he was afraid of the cost.
Our oldest son, Danny, passed away after battling cancer for 11 years. That led, even with an excellent health care program by his employer, he still incurred a tremendous amount of debt. He needed the care to maintain his life. The outcome of that perseverance on his part was an extremely heavy and, I feel, unwarranted financial burden.
One day I was sitting at my desk and all of a sudden I got a terrible headache. So I just pulled in the emergency room and said, "Hey, I think something's wrong with me." And they ended up doing a CT scan, and next thing I knew I was on a helicopter going to Portland and had surgery that night because I had a ruptured brain aneurysm. I was haunted by the fact that what if we didn't have insurance? I mean, aside from having this physical event, then I would have had to worry about $343,000, which is like a house you never live in.
As an artist and as a freelancer, I am drawn to other artists, and healthcare often comes up because it's a similar stressor for others, and there's a mounting frustration that we are very healthy people. We eat well, we exercise, we do all the things to keep ourselves in physical shape, almost to a point of becoming obsessive about our health, just to protect against having a big financial expenditure come in, ruin us because of some injury that we have no control over.
I've got cystic fibrosis. I worked, I paid my taxes, I did everything that I should, and I am struggling to pay for my health care costs because of a genetic disease that I had nothing to do with.
Our country really needs to figure out how we're going to take care of people. I've seen other people say that other countries have great health care. When we read about Canada and the health outcomes of people that are treated there for CF, their life outcomes are much better than they are right here in America. And I think that's really sad.
My medical condition is very complicated.
When we met and talked about getting married, I had to consider what that really meant for my life and the life of my children.
I'm a registered nurse and I had to basically retire because of my health.
We have a constant threat hanging over our head.
I end up with lots of pneumonias.
It's really difficult for both of us at this point in our lives to think how we're going to continue to pay for things when we constantly know that the next hospital visit could be right around the corner.
I've been in the hospital 2 or 3 times just this year. That is why I had to quit my job.
We all try to stay optimistic and cheerful, but it is difficult to watch.
I went to college, I got a good job, made a decent wage, but I have no money to show for it because of my disease and my health care. So I'm fortunate that I have a spouse that has insurance.
Had to take Doug to the hospital and we hugged our daughter goodbye and left her in tears.
My life depends on having insurance.
And she's always saying, "What's going on? How's it going?" And I don't always have a good answer.
I've had to switch insurance from my employer to my wife's insurance from her employer. which was no easy task, and I'm still having difficulties with that.
This illness is terminal, and it's nobody's fault. There's nothing you can do about it.
I have to get all my pre-approved medications pre-approved again, even though I've been on them for years. So that takes time.
But you just never know how much time you might have.
The other thing is the out-of-pocket costs. I pay it all for one insurance company, then I switch and I have to pay it all over again for the next insurance company.
It's horrible to be in our 50s and feel like we can't cover our health insurance costs to make sure that everybody has adequate care.
It makes me feel inadequate because I'm not able to support my children when they need the support. We can't make our mortgage anymore. We have nothing in savings because all of our savings went to healthcare costs. Just one medication, for example, that I use, I nebulize it twice a day, costs $8,000 a month. And that's just one medication. I'm on probably 15 to 20 medications.
It's stressful. Stressful.
So one of the impacts of our private insurance system in this country is the impact it has on healthcare professionals.
Doctors are dealing 25% of their time with electronic paperwork, fighting with insurance companies, trying to get pre-authorizations, fighting against denials.
In all situations that I had to deal with an insurance company, I never dealt with someone who knew more about medicine than myself.
Patients suffer, so do the doctors. This would be alleviated by a system where payments come through one source and there's not 100 insurance companies, each with a dozen plans, that are creating such complex and costly additions to our healthcare system.
If we just had universal care, all of that paperwork and extra time and money that they're spending on my case would not be accrued.
Most doctors feel that we need a universal healthcare system.
I'm looking at universal health care, publicly funded, and see that it's done correctly in 10 other countries around the world that have a better healthcare system than we have in America. And the reason these systems are better is because there is one standard for all patients, that they get equitable, affordable care that meets their needs.
I was born in New York. I was lucky enough to live in Canada for about 30 years. Ended up being a single mom there and working in the media. And as a freelancer, I would not have had health care here in the United States. I had terrible hip arthritis and had both hips replaced, which was only possible because I was living in the Canadian healthcare system.
So at Mid-Valley, we wondered whether people really did support universal health care in Oregon. So one of our members took it upon himself to contract with Elway Research to find whether that was true or not. And the poll had 3 parts. The first part was, do people perceive that we have a problem in our healthcare system?
You know, these are randomly selected participants, and people readily acknowledge that yes, there is a problem with paying for health care in Oregon.
The second part of the poll wanted to find out whether people thought a publicly funded single-payer healthcare system would be the best solution. 3 out of every 4 people in Oregon think that is the best solution.
So the poll then asked the question, would you be willing to pay a sizable dedicated tax if it would replace your current costs for health care, including premiums, deductibles, out of pocket? And 62% of the respondents said yes, they would.
Without knowing the cost, they were sort of favorably disposed to pitching in, which was a great result.
If you would like to get involved in encouraging the legislators in the state of Oregon to enact a universal health care system, now is the time, because a bill was passed in the last legislature, Senate Bill 770, which puts us on the path to universal health care.
This was the result of many advocates across the state talking to their legislators and volunteering their time to help get this done.
That doesn't mean we're going to get there, though. Our legislators and the task force created by this bill need to be encouraged, and there are many ways that you can encourage them. If you would like to get involved with our particular organization, we would welcome you to come.
And as I interact with other organizations and other people around the country, around the nation, it just feels like we are on the verge of another social cultural evolution where this country will achieve publicly funded universal health care so that all Americans will have access to affordable health care.